Okay, so you want to own a hospital. Beds, doctors, ambulances pulling in at 3 a.m., and a building people are physically relieved to see. Sounds like one of the most stable businesses on earth. Everyone needs healthcare eventually. Nobody negotiates on price when they're bleeding. Here's the part nobody tells you. In one Memphis hospital's own paperwork, a woman earning $9.05 an hour owed $12,019. The hospital sued her, added interest 7 separate times over 10 years. By the time a court finished with her, she owed $33,000 on a payment plan that would have had her paying it off around age 90. That hospital doesn't pay federal income tax. In most states, it doesn't pay property tax either. It is registered, by law, as a charity. By the end of this video, you'll know exactly how a charity becomes the most aggressive debt collector in its own county, filing more lawsuits than the banks, more than the landlords, more than the credit card companies, while paying nothing to the government that granted it that status in the first place. And you'll know why this isn't one bad hospital. It's what happens when nobody checks the math on an entire industry. So, let's price this thing out. Start with the building, because it tells you what kind of business you're in before you've treated a single patient. A hospital bed costs $2 million to build once you add operating rooms, imaging equipment, and the sheer density of plumbing a working hospital needs on every floor. Ohio State opened an 820-room tower in early 2026 for nearly $2 billion. Sutter Health is putting $2.8 billion into a single medical center in Santa Clara right now. Before you've hired one nurse, you're already running one of the most expensive businesses in America. And once the doors open, the margin is razor thin. Labor eats roughly 60 cents of every dollar every doctor, every nurse, everyone who has to be there at 3 a.m., whether you can afford them or not. After that, according to Kaufman Hall, the consulting firm that tracks roughly 1,300 hospitals a month, the national median operating margin runs somewhere around 3 to 5% in a good year. A McDonald's franchise clears around 6%. A hospital with surgeons and MRI machines and a trauma unit makes less per dollar than a fast food restaurant. But that median is hiding something. Kaufman Hall's own quartile data shows the gap. The top quarter of hospitals run close to 15% margins. The bottom quarter is already 2% in the red every year, without exception. As recently as 2023, roughly 40% of hospitals nationwide operated at a loss. Hundreds have closed in the last decade, mostly rural, mostly small, mostly the only option in town. Here's why the margin is so unstable. More than 60% of most hospitals' revenue comes from Medicare and Medicaid. Government programs that pay less than what the care actually costs. A hospital survives by overcharging privately insured patients to cover what the government quietly underpays everywhere else. That's not a scandal. That's the architecture. It's been running this way for decades. So here's your real range of outcomes. You could own a rural hospital bleeding money every month until it closes. Or you could land at the profitable end, 15% margins, cash reserves, and a legal team, and then the real question starts. What does that margin get used for? In one case, the answer was more lawsuits. Her name was Carrie Barrett, part-time worker at a Kroger in Memphis. In July 2007, doctors found a problem with her heart and threaded a catheter through her groin to fix it. She left 2 days later with a $12,019 bill. She says she never got a notice asking her to pay it. In 2010, the hospital sued her. The hospital was Methodist Le Bonheur Healthcare, and Barrett wasn't close to a loan. Between 2014 and 2018, court records show Methodist filed more than 8,300 lawsuits over unpaid bills in Memphis, more than any creditor in the county except one. Not more than other hospitals, more than banks, more than landlords. Some of the people it sued were its own employees, making under $13 an hour, enrolled in a health plan that didn't let them seek cheaper treatment anywhere else. Methodist garnished wages in nearly half of the cases it won, a far higher rate than either of its two biggest local competitors. Here's the deal that made all of this legal. More than half of America's roughly 5,000 hospitals are structured as nonprofits, no federal income tax, and usually no property tax. In exchange, the EARS asks for community benefit, charity care for people who can't pay. The tax exemption is supposed to replace the tax bill. That's the trade. Nobody outside the hospital checks the math while it's happening. The hospital reports its own numbers once a year, on a form almost nobody reads. The Loan Institute ran the numbers on 275 major nonprofit hospital systems. 227 of them, more than 4 out of 5, spent less on charity care than their tax exemption was worth that year. The tax break was bigger than the charity it was supposed to buy. At 227 out of 275 hospitals, simultaneously, Methodist wasn't a rogue actor. It was the normal condition of the industry's most financially comfortable institutions. It just happened to be the one documented clearly enough for a reporter to count. If Methodist is the local version of this story, Providence is what it looks like scaled up, with a consulting invoice attached. Providence is one of the largest nonprofit hospital systems in the country, 51 hospitals, hundreds of clinics, more than $27 billion in annual revenue, tax exemptions worth over $1 billion a year, and roughly $10 billion sitting in financial investments. It even runs its own venture capital fund, the kind of thing you'd expect from a private equity firm, not a hospital chain built on a charity mission. In 2018, Providence paid McKinsey & Company $45 million to build a program called RevUp. Read that again. $45 million paid to the most famous consulting firm in the world to train hospital staff on how to collect money from patients. The training materials, later quoted directly in Washington state lawsuit, told staff to ask every patient every time and to never accept the first no. Soliciting payment, the materials said, is part of your role. It's not an option. Patients who still didn't pay went to a debt collector sometimes before anyone mentioned they might qualify for free care under Providence's own charity policy. The same policy the billion-dollar tax exemption was supposed to fund. The state's complaint says Providence sent more than 54,000 charity-eligible patient accounts to debt collectors' anyway accounts worth more than $70 million. One of those patients was Alexandra Nifors of Everett, Washington. She spent 2 weeks in a Providence-run hospital being treated for kidney failure and a serious infection. She said the medical care itself was excellent. What followed it wasn't. While RevUp ran, Providence's own charity care spending fell from just over 1% of expenses to under 1%, while the nonprofit hospital average nationally moved slightly upward. A system holding $10 billion in investments is spending less on the poor than it had 5 years earlier, while paying outside consultants tens of millions to make sure fewer patients slip through without a bill. So, does owning a nonprofit hospital actually work as a business? Here's the honest range. The optimistic scenario. You're one of the top quartile hospitals, with 15% margins and cash reserves deep enough to weather bad years, and you run your charity care obligations straight. Every dollar of that tax exemption goes back into the community it was meant for. That's a legitimately good business, government-subsidized, recession-resistant, and it's why nonprofit hospital CEOs regularly clear 7 figures in total compensation while paying 0 corporate income tax on the enterprise underneath them. The realistic scenario is the one nobody puts in the brochure. You're sitting on that same 15% margin, and instead of expanding charity care, You spend $45 million on a consulting firm to tighten collections. You file thousands of lawsuits a year against people making minimum wage, sometimes your own staff. Your charity spending doesn't grow with your revenue, it shrinks. The gap between what your tax exemption is worth and what you actually give back becomes the profit center nobody names in an annual report. No fine fixes it, because the mechanism that would catch at a hospital grading its own homework once a year on a form nobody has to verify isn't broken. It's working exactly as designed. That's the entire model. In one comparison, one version of this business quietly does what the tax code assumes it's doing. The other version quietly doesn't, and there's no regulator built to tell the difference until a reporter starts making phone calls. None of this surfaced because a regulator caught it. It surfaced because reporters started calling patients. The Methodist stories ran in the summer of 2019. Within days, the hospital's own doctors were raising it with the board. A U.S. senator wrote a letter. Members of the United Methodist Church, the denomination the hospital is affiliated with, said publicly they were ashamed of what was being done in the institution's name. Within 5 hours, all court collection activity was suspended. Within 2 years, it erased the debt of more than 6,500 patients, including Carrie Barrett's. The $33,000 she'd still be paying at 90 dropped to zero in a single phone call. Methodist also rewrote its financial assistance policy, more than doubling the income threshold for who qualifies, and raised wages for its lowest-paid staff, some of whom had been among the people it was suing. One phone call. Zero, 12 years of interest and garnishment orders gone in a conversation the hospital could have made at any point in the previous decade, and simply didn't. Providence moved slower, and it took longer to get there. It phased out RevUp. The state kept litigating anyway, first against Providence directly, then against the 2 debt collection agencies Providence had hired, both of whom were later found to have broken Washington's disclosure laws hundreds of thousands of times over. In February 2024, nearly 2 years after the state first sued, Providence agreed to the largest resolution of its kind in the country. $137 million in medical debt erased, another $20 million refunded with interest, covering more than 99,000 patients. Alexandra Knifers was one name among that number. It took a state attorney general, 2 years of litigation, and 2 separate debt collectors getting caught breaking the law to produce that outcome. Methodist changed its policy after 1 summer of newspaper coverage. Providence needed a courtroom. Here's what should actually stay with you. Methodist changed. Providence changed. Because a reporter called, then another reporter called, then a senator wrote a letter, then doctors inside the building started asking questions in public. 2 hospital systems. Out of roughly 2,500 nonprofit systems in the country. The Loan Institute's 227 out of 275 finding wasn't about Methodist or Providence specifically. Those are just the 2 that got caught with enough documentation for a front-page story. The other 225 systems in that same study aren't in any headline. They filed their forms, reported their own numbers, took their tax exemption, and went about their year. Washington could act because it has one of the strongest state charity care laws in the country, and it's one of only a handful of states that actually enforce one. That's what caught Providence. It's not what governs the tax exemption itself. The federal mechanism, a hospital self-reporting its own community benefit once a year on a form the ears doesn't audit, is still sitting in the tax code exactly the way it sat before either investigation ran. Most states have nothing like Washington's law. Most hospitals will never meet a Bob Ferguson. So if you're still picturing yourself owning a hospital, remember that the building was never really the business. A hospital doesn't fail or succeed the way most businesses do. on the strength of what it treats. It runs on a tax status nobody double-checks, layered on top of a payer mix nobody controls. And the difference between the hospital that forgives your debt and the one that chases it into your 80s comes down to something as small as whether a reporter happened to make the right phone call first. If you want to see what happens once the bill actually reaches you, how a single bag of saline gets priced at $700 on a hospital invoice that's the next one. Subscribe so you don't miss it.